We're in an election year. I'm not going to ask you to weigh in on the politics of it, but I did see an article that said that healthcare will not be as much of an issue in this year's federal election. And I was surprised at that. They said this will be like a fourth or fifth priority. I was surprised at that. And then I started thinking about it. I'm like, hey, with the various wars that are going on around the world, with the border challenges, I started to see how healthcare could get pushed back in the priority. Do you feel like it's not going to have as much of a front and center as it's had in previous election cycles?
I think elements of it will continue to rear their head. We stay in the healthcare technology and digital health space, so I'm sure you could think about some of the things that are going on that are trigger issues. But I always think that healthcare, it is a voter issue because everyone is a patient, right? We're all patients, and it's close to home. I think there's been a lot that's happened around price transparency, something we don't get too involved with in Chime. Social determinants of health. Anything that affects someone's pocketbook at home is a voter issue. So I don't know if it's going to be like the top issue. I wouldn't say that, but I certainly think it's going to continue to be in the back of people's minds. Like the economy still is not perfect, right? Despite the pressure, you can see it at the hospitals. So workforce. So I always think, even though we don't advocate directly in workforce, it has a spillover effect onto everything. So that means the economic condition of an American family often involves your spend on healthcare.
Absolutely. Still, the leading cause of bankruptcies in the United States is
Exactly.
medical bankruptcy. I'm surprised that there is no healthcare candidate right now. There's like nobody who's like running on healthcare. But with the financial aspects of it, I think are pretty interesting. The amount of GDP it continues to take is pretty interesting. But I think sometimes when we get into the healthcare conversation to the individual, they're just like, I don't understand. You're deeply involved in it, and there's probably some things that you just scratch your head from time to time and go, "This is confusing." I know that when
Maybe every day in Washington Bell, where I scratch my head, I'm like, what do I do every day?